These are the most common leg injuries in athletes. They hurt, they limit your movement, and have a high rate of coming back once you've had one. In this video, we will be talking about hamstring injuries. These injuries are most common in sports requiring rapid speed changes or kicking. They account for probably about 20% of all injuries sustained in sports. We will review the anatomy, causes, and treatments of these very common athletic injuries. The anatomy. What we consider the hamstring is actually three separate muscles located in the back of the thigh. The semimembranosus and semitendinosus are towards the inside of the leg, and the biceps femoris, which is on the outside. These muscles start on the pelvis in an area called the ischial tuberosity. This is the bone you can feel as you sit down on something hard. The hamstrings then travel down the back of the leg, past the hip joint, and towards the knee. The biceps femoris attaches to the fibula head. This is the little bone on the outside of the knee. And the semimembranosus and semitendinosus attach at points on the back and the side of the knee. The semitendinosus actually joins up with two other muscles as it attaches to the inside of the knee. It is in this area that it can be harvested to create a new ligament, such as for an ACL reconstruction at the knee. The main functions of these muscles is to flex the knee, bring the heel towards the butt. The biceps femoris is the strongest knee flexor. The hamstring muscles also contribute to knee joint stability. These muscles also contribute to hip motion in that they help extend or bring the leg backwards at the hip joint. The mechanism of injury. As mentioned, these muscles span both the hip and the knee. They cover a large area. They are expected to move a lot and generate a lot of force. The muscles are most stretched when the hip is flexed and the knee is extended. This situation often occurs when sprinting, especially with hurdling, but also happens during a kick. Most muscle tendon injuries, in general, occur within a normal range of motion. There are certainly times when things are forced further than they should go, but for the most part, these injuries happen when you're going through normal motion. For most tendon muscle injuries, it is during eccentric loading, contracting but lengthening of the muscle that puts the most stress on the structure and when things tend to fail. If you can imagine, this eccentric loading happens while running or kicking when the knee is near full extension and the hip is flexed, further stretching the hamstrings. Then the hamstrings are contracted to either push off the ground or bring the leg back to where it needs to go. When the hamstring fails, it usually occurs within the muscle. Sometimes at the junction of the muscle and tendon, the musculotendinous junction. Rarely, the tendons are torn off the bone. Risk factors for injury. Many things can contribute to this injury. These include inadequate warm-ups, underlying strength imbalances, one hamstring stronger than the other, or the quadriceps muscles in front of the leg aren't as strong as they need to be. Or perhaps there's a lack of flexibility. This is slightly controversial. Other things, such as core strength and stability. Again, the pelvis is involved with the hamstrings, definitely contributes. Additionally, factors such as dehydration and fatigue can contribute to injury. Lastly, and most importantly, once something has been injured, there is the increased likelihood of re-injury. It is believed that having had a prior hamstring injury increases the risk of re-injury 2 to 6 times. Symptoms. There's often a sudden, sharp pain in the back of the thigh. Sometimes there is an associated pop. Sometime later, bruising may be noticed at the back of the leg. Then there is weakness and pain when trying to flex the knee and or extend the hip. There's often pain with any hip or knee motion, and people start to walk in a weird way to avoid firing the hamstring, but also avoid stretching the angry muscle. The diagnosis. Often, x-rays of the pelvis and or knee are obtained based on where the pain is and can assess really for just if bone has been pulled off. An MRI is the best study of the soft tissues, but may not always be necessary. MRIs are crucial to planning surgery and can help guide non-operative management. For example, tears at the musculotendinous junction heal slower than if it's just in the muscle, and these tears have higher rates of recurrence. Part of the reason is that tendons just don't heal very well. Treatment. Surgery is rarely needed for hamstring injuries. Early, non-operative management includes the usual rest, ice, compression, and elevation. After a few days of rest, early range of motion can assist in a more organized scar forming and help prevent re-injury. Ideally, physical therapy is closely involved in this process. Other treatments that are being explored include shockwave therapy, corticosteroid injections, platelet-rich plasma, and even stem cells. But solid research is still being worked out, and nothing appears to be a game changer at this point. As the patient makes improvements with physical therapy, certain exercises can be emphasized. Eccentric exercises, the muscle contracting but lengthening, can help speed up regaining strength. Identifying and correcting muscle imbalance is crucial. This includes exercises of the quadriceps, hip, and core. Also, to prevent re-injury, the most important thing is to return to sports only when the patient no longer has symptoms and there's been a good return of strength. When this happens is determined by many factors, including where the hamstring was injured and how bad the tear was. Surgery. Sometimes surgery is necessary. As always, these decisions should be determined by a specialist. Surgery is considered if multiple tendons have been torn and there's retraction or pulling away from the bone. People who are not so active may not need surgery even if this stuff is going on. Another circumstance for considering surgery is for chronic injuries in high-level athletes who have failed appropriate non-operative management. There is a phenomenon called hamstring syndrome, and it involves pain at the buttock when sitting or stretching that can be disabling and is attributed to a scar forming. Another more rare circumstance is if the sciatic nerve becomes irritated or trapped in scar. Tears at the knee are less common, but in high-level athletes that require a quicker return to play, surgery can be considered. If the tendons tore, then sutures are used to sew them back together. If tendons pulled off bone, then surgery involves putting the retracted tendons back onto the bone. This could be the ischial tuberosity or rarely the knee if the tear is down there. At the ischial tuberosity, this is usually done with suture anchors. These are things that go inside the bone with sutures coming off of them that you grab the tendons and pull it back down to the bone. This does require a large incision. The most important thing that the surgeon must do, other than fixing the ruptured tendons, is to protect the sciatic nerve. It is right there. The sciatic nerve is very important as it controls the muscles and sensation of the lower leg. Postoperative rehab. For about 6 weeks, the repair must be protected. This often involves limiting how much weight is put down on the leg and keeping the hip from flexing and the knee extending by using a brace. Sometimes surgeons recommend taking medications, often aspirin, to prevent blood clots for a period of time. Physical therapy with range of motion is often started at 2 weeks from surgery. At 6 weeks, weight-bearing restrictions and bracing is usually not necessary. Sport-specific training, running, jumping, explosive movements can usually start around 3 months. Return to sport is not allowed until there is no pain, there's adequate strength, and range of motion has returned, and this often takes up to 6 to 10 months. Outcomes from surgery are usually very good as far as patient satisfaction is concerned, but there's often some weakness that remains. Overall, for the bad injuries, surgery has better outcomes than non-operative management. I'm Dr. Lucius Pomeranz, board-certified orthopedic surgeon. If you like these videos, please hit the like button, share with your friends, and subscribe.